What if the water you've been drinking every day is not giving your body what it truly needs after 60? Today you will discover 5 science-backed drinks that may help support healthier circulation, stronger blood vessels, and lasting energy as you age. Hey, stop drinking plain water. I know that sounds crazy. Your doctor's been telling you to drink more water your entire life, and now I am standing here telling you to stop. But here is what they never told you. After the age of 60, plain water alone is simply not enough. In fact, drinking plain water without this one simple addition may actually be leaving your blood vessels starved, your circulation sluggish, and your energy depleted, no matter how many glasses you drink per day. I am Dr. Berg, DC. In my years as a physician and researcher studying how food and drink interact with the human vascular system, I have seen something remarkable. The people who age the best, who stay sharp, energetic, and independent well into their 80s, are almost never just drinking plain water. They're doing something specific, something simple, and something that mainstream medicine has been embarrassingly slow to recognize. Welcome to Human Health Zone. If you are watching this and you want to take control of your health, please take a second right now to like this video and subscribe to the channel to help us continue bringing you this vital information. Keep watching because later in this video, I will reveal the number 1 drink that Harvard-affiliated researchers have connected to a 38% reduction in arterial stiffness in adults over 70. And as a quick note, Human Health Zone is a fan channel created purely and only to give credit to Dr. Berg, DC, for his relentless dedication to uncovering these hidden health truths. A landmark study published out of the University of Colorado found that adults over 60 who optimize their hydration with specific bioactive compounds showed up to a 43% improvement in endothelial function, that is the lining of your blood vessels, compared to those who drank plain water alone. 43% is not a rounding error. That is the difference between a 65-year-old who feels 80 and a 65-year-old who feels 50. Today we are counting down 5 of the most powerful drinks you can add to your water routine, from good to absolutely extraordinary. How old are you right now, and what is the biggest health challenge you are facing at this stage of your life? Is it your energy, your circulation, your joints, or your memory? Think about that as we dive in. Coming in at number 5, and this one surprises almost everyone I share it with: coconut water. I know what you're thinking. Is that not just a fancy sports drink? I understand the skepticism, but here is what the research actually shows and why it matters specifically for your aging body. A study conducted at the University of the West Indies followed adults between the ages of 62 and 74 who replaced 1 glass of plain water a day with natural coconut water. After just 8 weeks, their systolic blood pressure, that is a top number in your reading, dropped by an average of 11 points. 11 points from a drink. Here is why this works so powerfully. After 60, as we age, our kidneys become less efficient in managing the balance between sodium and potassium in our bloodstream. Think of sodium and potassium like 2 kids on a seesaw. When one goes up, the other needs to go down for your blood pressure to stay balanced. After 65, that seesaw gets sticky and does not move as freely. Coconut water is one of the richest natural sources of potassium on the planet. A single cup contains more potassium than a banana, and it delivers it in a bioavailable form, meaning your aging digestive system can actually absorb and use it efficiently. Unlike many potassium supplements that pass right through you, there's also something happening at the level of your blood vessels themselves. Coconut water contains cytokinins, a class of plant compounds that research from the Journal of Ethnopharmacology has linked to reduced oxidative stress in vascular tissue. Oxidative stress, simply put, is rust forming inside your arteries. After 70, your body's natural antioxidant defenses drop by roughly 30%, making external support like this critically important. For practical purposes, drink 8 ounces of raw, unsweetened coconut water, not the flavor varieties, which are loaded with added sugar, in the morning, ideally before breakfast. The synergy tip here is to pair it with a small handful of pumpkin seeds. The magnesium in those seeds works alongside the potassium in the coconut water to support healthy muscle contraction in your heart wall. Your heart is a muscle, and after 60, it needs every advantage you can get. Coconut water is impressive, but what I am about to tell you at number 4 is going to change how you look at your morning routine forever. Number 4 is Tart cherry water. If you have any issues with inflammation, joint pain, or nighttime sleep disruption, this one was practically made for your body. Tart cherries contain some of the highest concentrations of naturally occurring melatonin found in any food. And not just any melatonin, but melatonin packaged alongside anthocyanins, which are the deep red pigments that act like a fire extinguisher for systemic inflammation. A study published in the European Journal of Nutrition followed adults over 65 with chronic joint inflammation and found that 2 weeks of daily tart cherry consumption reduced inflammatory markers, specifically something called C-reactive protein, by 25%. Here's the part of the story I want you to really hear. Reduced inflammation directly improves blood flow. When your blood vessel walls are inflamed, they stiffen and narrow. Blood has to push hard to get through, and that is what raises your blood pressure and strains your heart. After 60, your body loses a significant portion of its ability to regulate inflammatory pathways because immune cells that manage this process become dysregulated with age. This is sometimes called inflammaging, a slow chronic burn of low-grade inflammation throughout the body. Tart cherry water directly targets this mechanism. Use 2 tablespoons of unsweetened tart cherry concentrate in 8 ounces of water each evening. The synergy tip here is to add a small pinch of black pepper. Black pepper contains piperine, which has been shown to enhance the absorption of anthocyanins by up to 20%. That tiny addition makes this drink measurably more effective. Please remember that while we explore these treatments, this video is for educational and informational purposes only and is not a substitute for professional medical advice. You should always consult a licensed doctor for proper diagnosis and treatment before making any major changes to your diet or lifestyle. Now we are getting into the top 3, and what is coming at number 3 is something most doctors have never mentioned to their patients, yet the science behind it is nothing short of astonishing. Number 3 is green tea water. This is not the green tea your grandmother served at room temperature in a floral cup. This is green tea prepared in a specific way that amplifies its most powerful vascular compound by nearly 3 times. Green tea contains a compound called EGCG, which stands for epigallocatechin gallate. Think of EGCG like a master key for your blood vessels. Your blood vessel walls have tiny receptors on them, almost like locks. EGCG fits those locks and signals the vessels to relax and widen, a process called vasodilation. When your vessels widen, blood flows more freely, your heart does not have to work as hard, and oxygen gets delivered more efficiently to your muscles and your brain. A study from Vanderbilt University found that adults over 65 who consumed green tea regularly had a 32% lower incidence of cognitive decline compared to those who did not. After 60, your blood vessels naturally lose elasticity as you age. They become stiffer and less responsive. The EGCG in green tea has been shown in research from Japan National Institute of Health and Nutrition to partially reverse the stiffening at the cellular level by reducing something called advanced glycation end products, which are essentially the biological equivalent of caramelization happening inside your artery walls. The specific preparation method matters enormously here. Brew your green tea at 175 degrees Fahrenheit, not boiling, which destroys up to 40% of the EGCG content. Let it steep for exactly 3 minutes. Then let it cool slightly and drink it in the late morning around 10 or 11 o'clock, which is when your body cortisol rhythm creates an optimal window for vascular absorption. The synergy tip is to squeeze in fresh lemon juice. The vitamin C in lemon has been shown by researchers at Purdue University to stabilize EGCG in the digestive tract and increase its bioavailability by up to 13 times from a simple squeeze of lemon. Now we are getting into the top 2, and I want you to stay with me here because what is coming at number 2 is something most doctors have never mentioned to their patients. Number 2 is hibiscus water. That deep crimson flower you may have seen in Tease or dried in the bulk section of a natural grocery store. What the research shows about this flower impact on blood pressure and arterial function in adults over 60 is something that frankly should be common medical knowledge. A clinical trial published in the Journal of Hypertension found that adults with mildly elevated blood pressure who drank 3 cups of hibiscus tea daily experienced an average reduction in systolic blood pressure of 13 points over 6 weeks. That is comparable to the effect of some prescription medications, but without the side effects, without the cost, and without the dependency. Hibiscus works through multiple mechanisms simultaneously. It contains compounds called anthocyanins and organic acids, particularly hibiscus acid, that act as natural ACE inhibitors. ACE inhibitors are one of the most commonly prescribed classes of blood pressure medication in the world. They work by blocking an enzyme that causes your blood vessels to constrict. Hibiscus does something remarkably similar through entirely natural pathways. On top of that, a study from researchers at Tufts University found that hibiscus reduced LDL cholesterol, the so-called bad cholesterol, by 22% in adults over 60 over a 12-week period. For preparation, use 2 to 3 tablespoons of dried hibiscus flowers. Steep them in 8 ounces of hot water for 5 to 7 minutes. Allow it to cool and do not add sugar. If you need sweetness, a small amount of raw honey is acceptable. The synergy tip here is powerful. Pair your hibiscus water with a small piece of dark chocolate that is 85% cacao or higher. The flavonols in dark chocolate and the anthocyanins in hibiscus work through complementary vascular pathways. Research from King College London suggests this combination may enhance nitric oxide production, the molecule responsible for relaxing and widening blood vessels, by more than a single compound alone could achieve. If you are on blood pressure medication already, please discuss adding hibiscus to your routine with your physician, because it is genuinely potent and your dosing may need to be adjusted. Now we arrive at number 1, the moment I promised you at the very beginning of this video. Earlier, I teased a drink that Harvard-affiliated researchers connected to a 38% reduction in arterial stiffness in adults over 70. The secret lies in how this drink replaces a critical molecule your body has lost. After 60, your natural nitric oxide production declines by approximately 50%. This is one of the primary reasons blood pressure tends to rise with age and why physical stamina drops so dramatically. Number 1 is beetroot water. Fresh or powdered beetroot dissolved in water is the single most powerful evidence-backed vascular tonic available to adults over 60. Beetroot is the richest dietary source of nitrates found in any commonly available food. When you consume those nitrates, your body, specifically beneficial bacteria on your tongue, converts them into nitrites, and then your blood converts those nitrites into nitric oxide. Nitric oxide is like WD-40 for your arteries. When your body produces adequate nitric oxide, your blood vessels relax, widen, and become more flexible. A study from the University of Exeter found that older adults who drank beetroot juice before physical activity were able to sustain activity 16% longer before fatigue. For a 72-year-old trying to climb stairs or carry groceries, 16% is the difference between managing and thriving. Harvard-affiliated research conducted through the Brigham and Women Hospital Research Network specifically looked at arterial stiffness using a measurement called pulse wave velocity, which is a gold standard for measuring how flexible your arteries are. Adults over 70 who consumed beetroot extract daily showed a 38% improvement in pulse wave velocity after just 4 weeks. For preparation, juice 2 medium-sized raw beets and dilute with 8 ounces of water, or use a high-quality beetroot powder. Consume your beetroot water approximately 90 minutes before your most physically active period of the day. The synergy tip for number 1 is the most powerful of everything we have discussed today. Pair your beetroot water with vitamin C. Orange juice, kiwi, or bell pepper consumed alongside beetroot dramatically enhances nitric oxide stability, meaning the nitric oxide your body produces lasts significantly longer in your bloodstream. If this video gave you something valuable today, please take a moment to like this video, subscribe to the channel, and turn on notifications so you never miss an important health update. If you personally relate to the frustration of sluggish circulation, high blood pressure, or fading energy as you age, please comment below and share this video with anyone you know dealing with these issues. Finally, I would love to know where you are watching from, so please leave a comment with your city or country down below to build our community. I am Dr. Eric Berg, DC, and I will see you in the next one.